In this video, I'm going to talk a little bit about low back pain and just give some useful facts for patients who are suffering from low back pain. If there's anything specific that you would like to know or questions you might have, please feel free to put questions below the video. However, bear in mind that I won't be able to answer individual or personalised medical queries. So low back pain is one of the most common reasons for a patient to have a GP consultation. Back pain can be acute, it can be subacute, or it can be chronic, and all of these are defined by the length of time the symptoms are present. So acute pain would be pain lasting anything less than 6 weeks. Subacute pain would generally be lasting between 6 weeks and 3 months. And chronic pain is anything lasting greater than 3 months. And within these pain categories, the pain can be episodic, meaning that you just get it from time to time, or it might be triggered by certain activities. Or the pain can be more continuous. It can be mild, it can be moderate, or it can be severe. Lower back pain then is further divided into pain that's considered to be specific, meaning that you might have had an MRI scan and it shows that there are changes in your back that are felt to be likely to be causing your pain, or non-specific, where no particular structural cause has been found for your pain. Now, a lot of patients who are diagnosed or suffering from low back pain will actually fall into this category of non-specific low back pain. And while it is quite descriptive, it's not all that helpful because it implies that if there is no cause found for the pain, will the pain improve? And this is kind of based on the belief that if you have pain and a cause is found, then there will automatically be a management plan or a resolution for that pain. And this is not typically the case. It is increasingly understood that low back pain is more likely to be a longer lasting condition with kind of intermittent exacerbations of this over time rather than unrelated occurrences of low back pain. And I would say a lot of patients who suffer from low back pain would concur with this. Most cases of back pain improve substantially within 6 weeks, and by 12 months the average pain is quite low. The advice is to keep moving if it is possible and to minimize rest if possible. Now, the pain might be quite severe and you may be limited initially, but the message really is that pain in and of itself does not signal that there is any further damage being done. The message being physical activity will not worsen your symptoms. So physiotherapists have actually developed this very useful traffic light system to help you guide what activity you can do based on the pain you're having, and I'll describe this in the next slide. So in order to use a traffic light system, you just need to think about how long your pain has been present for. So has it been present for about 4 to 8 weeks, 8 to 16 weeks, or 16 weeks or longer? And the reason for this is that if you have low back pain for a longer period of time and do an activity that makes the pain a little bit worse, it may take longer for you to return to your baseline. So it's important just to be aware of that. So the green light would be pain that's between 4 and 7 on the 0 to 10 scale, but it is no worse or back to baseline within 30 minutes if your pain has been present for about 4 to 8 weeks. 2 hours if 8 to 16 weeks, and 24 hours if 16 weeks or longer. The action plan here is that you can be confident in adding more activity. The yellow light describes pain that is between 4 and 7 on the 0 to 10 scale, but that persists at about 3 points above your baseline for 2 hours if you're 4 to 8 weeks following the pain onset, 24 hours if 8 to 16 weeks, and 48 hours if 16 weeks or more following the onset of the pain. The action plan here is that you can stay the course with the activity, and the main message again being that pain in and of itself does not necessarily signify harm or damage being done. Then you have the red light. So this would describe a severe spike in pain that occurs during the activity and stops you from doing it. and persists for days to several weeks. Now, in this case, you should stop the activity and you should perhaps get an assessment by your healthcare professional. What is very useful about this system, and I didn't mention it on the previous slide, is that you can also check for evidence of harm. So within each category, so let's say you get a little bit of pain or 3 points above average, like the green light or the yellow light, you can also within these categories check your mobility. So you might stand and then bend over and try to touch your fingers to the floor. You might do a squat down and squat back up, or something you might have already done with your physiotherapist, just to check that your mobility is okay in spite of a worsening of the pain. So again, the emphasis here is moving away from pain being a signal of damage or injury to just making sure that your mobility is okay and that within a reasonable amount of time your pain is no worse. Obviously, pain can be debilitating too, but it is just a way of reframing the pain and trying to remove that significant worry component that a lot of patients understandably have when they are suffering from low back pain. So pain itself is a subjective experience. If someone tells you they are in pain, and it cannot be easily measured. But from a medical point of view, we have different ways of describing the different types of pain. So nociception would just be pain that's caused by any mechanical injury or mechanical stress, and it simply activates pain pathways, and it's a pain that we're all familiar with from time to time. Neuropathic pain is a pain that is thought to be caused by a nerve injury, so it can have a more burning type of quality, or it can be like a pins and needles or a shooting sensation. Nociplastic pain then is a term that's actually more recently described, but probably has been known for a long time. And it describes the amplification of pain signals within the brain. And it's related to having ongoing chronic pain and the emotional responses to the potential impact this pain has on your life. And it is very well established in the pain literature that this has a significant impact upon your experience of pain. In the context of low back pain, the nociceptive pain would be caused by mechanical stressors. These can accumulate over time. They're not necessarily associated with any nerve compression. And they're things that happen day to day that you won't necessarily be aware of. There won't be necessarily a defined injury as such. Neuropathic pain then implies that there may be compression of nerve roots in your back that supplies the leg, and that would be causing symptoms that might shoot down the leg. We're all familiar with the term sciatica, and that's really referring to compression of nerve roots in the back in the distribution of what we understand as a sciatic nerve. Then nociplastic pain would be the pain that will continue in spite of, let's say, the triggering activity has been removed. And this refers to the amplification of pain within the central nervous system. And again, things like worry about the potential impact of pain on your ability to work or your ability to carry out leisure activities or play with your children, or those kinds of things can actually have a significant impact upon the pain experience. We also like to treat pain with the biopsychosocial model, and this is more kind of just to recognize that pain affects the whole person as opposed to just the inciting injury or just the actual location of the pain as such. So this is well recognized now, and it is actually a much better way of treating pain. So you're treating pain as the whole person rather than just the pain in the low back itself. So it's divided into a number, again, of kind of categories or components. One is the pathoanatomical, and this really means whether or not you have degenerated discs in your back or a disc bulge or wear and tear on your spine. Then there's a physical component, and this would mean that because you have pain, that you may be contracting muscles in order to somewhat protect your spine, or that you may just be doing less activity because of the pain, so you become a bit deconditioned. The psychological components of pain are very well understood, and you might have certain beliefs about pain. Pain can be a scary thing. You might feel like it's going to have a significant impact upon your ability to work if you do a physical job. It might have an impact upon your leisure time activities. You might be joined a club or something, and you may feel that you're not going to be able to participate. And there can be social impacts as well. And that again refers to, you know, if you are in, let's say, a tennis club or a sports club and you feel like your low back pain is going to preclude you from participating in those activities, it can also have a significant impact upon your experience of the pain. So we talk a little bit about the fear avoidance model. I'll just touch on it here. So it's really, again, just acknowledging that fear of pain and fear of what pain can do can really lead to exacerbation of pain. And this is a well-established theory in all forms of pain, not just low back pain. We also talk a little bit about pain self-efficacy, because this plays an important role in pain management, because self-efficacy refers to your perception of your own ability to manage the symptoms you have. So if you have a lot of pain and feel like you're never going to get on top of it or never get control of it, then this can have a very negative impact upon your overall experience of the pain. And again, this all happens because pain is much more than just activation of pain pathways. And in medical terms, it's much more than just nociception. However, when pain is perceived in the brain, it'll immediately start thinking about how this pain is going to impact your life. And that is really important to acknowledge. And new research addresses, so there's a lot of research about the value of physical activity in the management of pain. But one way in which it's thought to help pain is that it leads to less fear associated with pain. So if you're doing physical activity, you may then begin to see that you can do physical activity in spite of your pain. And while this may not reduce the actual pain level itself, it can significantly improve your functional ability. Now, physical activity does in a lot of cases actually help with the pain as well. And in a separate presentation, I'm going to go in detail through the different kinds of physical activity that should help with low back pain. Again, the risk with something like a fear avoidance model is that you will become fearful of physical activity and thereby you will then avoid it, and then this lack of physical activity can have an overall negative impact upon your well-being. And it can lead to a vicious cycle because you will avoid behaviour that can lead to some further disability, and then that can lead to worsening of the pain. Now, initially it might make sense. You may be thinking, well, when I do this particular movement, that will worsen my pain or bring on my pain. And it may be the case that in the very, very early stages of the acute onset of pain, you may need to rest up a little bit, but this will be the smallest component of your management and will be minimized as much as possible. It is very important that if you have these concerns and you are worried about things making your pain worse, that are things that you would really like to be doing in your life, that you should keep a list of these questions, and when you visit your healthcare professional to maybe have a conversation and discussion about these. It is well established that when symptoms are perceived as unpredictable and uncontrollable and potentially having serious consequences, they can lead to an overall fear response that will exaggerate underlying pain. So there are a number of unhelpful beliefs about pain, and I'm just going to spend a little bit of time explaining some of these. So it is a widely held belief that low back pain can be a serious condition, and that's not that surprising because you might have concerns when you have low back pain about the impacts, but it has been demonstrated that having lower back pain is not considered to be a serious condition in terms of future disability. Another one is that low back pain will become persistent and deteriorate later in life. And again, this is something that does not hold up in the literature, but unfortunately, having this belief can lead to doing less activity, and that is when pain can become a bit more persistent. Persistent low back pain is always related to tissue damage, and scans are always needed to detect the cause. Now, I'm going to do a whole separate presentation on the value of imaging in low back pain, and I think it is very understandable that if you have low back pain that you feel that a scan would be necessary and would be likely to give the underlying cause of the pain. But even though this is very well understood within the medical community, patients will still experience worry and fear awaiting their scan, and then disappointment when the scan doesn't necessarily provide the answer. So like I said, I will go through that in a separate presentation. It's also believed that pain that's related to exercise and movement is always a warning sign that harm has been done to the spine and is a signal to stop. And again, this is something that doesn't hold up in the literature. You might need to make small modifications to what you do, but in general, the spine likes movement. What it doesn't like is sudden movement or going from doing no activity to doing a huge amount of activity. And again, when we go through the physical activity management plan for low back pain, I'll explain that in a bit more detail. It's believed that treatments such as strong medications, injections, and surgery are effective and necessary to treat low back pain. And definitely for some patients, there is absolutely a place for pain medication, and in some patients, there is absolutely a case for a surgical intervention, but this is absolutely not always the case. And it is really taken in an individual sense and a case-by-case basis in terms of deciding what intervention you need. Unfortunately, unhelpful beliefs can lead to unhelpful behaviour, and it's a little bit of repetition of what I've said earlier, but if you feel that certain postures are likely to trigger your pain, then you might avoid this. And this might include avoiding meaningful activities that are work-related or social activities. Sometimes having the unhelpful belief that the core is responsible for the pain will lead you to kind of muscle guarding of the abdomen or slow and cautious movements. And again, this isn't particularly helpful for low back pain. And again, like I've kind of already mentioned a number of times, unhelpful beliefs can lead you to a negative mindset regarding the ongoing and the future pain, leading to pain vigilance. And again, avoidance of engaging in valued activities. Then when you couple this with the fear or a lack of self-efficacy in terms of ongoing protection and prevention of the pain, this can lead to negative impacts upon your mental health. So there's also a few helpful facts about low back pain that are useful to know. Low back pain, it's not a serious life-threatening condition. Most episodes of low back pain will improve, and it does not tend to get worse as we age. Having a negative mindset, fear avoidance, and negative recovery expectations and poor pain coping behaviour are actually more strongly associated with persistent pain than is tissue damage. And I should say at this point that these are very understandable emotions to have when you have pain. And what I'm trying to do with this set of education videos on low back pain is to try to dispel some of the myths regarding low back pain and to give patients very useful advice in terms of the overall benign nature of low back pain and things that you can do to try to help the low back pain. Scans do not necessarily determine the prognosis of back pain, and often it'll turn up changes that are felt to be age-related wear and tear. They're deemed non-specific and not for any particular intervention. Graduated exercise and movement in all directions is safe and healthy for the spine. And again, like I said in a prior slide, the spine and the back like movement, and what they don't like is a sudden massive increase in your movement. So if you went from doing no exercise to, doing a deadlift in the gym of 20 kilograms, yes, that is going to be a problem. Whereas if you start at 3 kilogram dumbbells in each hand and do a small number of them and gradually build up over time, you are highly unlikely to cause yourself any worsening of your pain. Spine posture during sitting, standing, and lifting does not necessarily predict low back pain or its persistence. Obviously, again, the same principles apply. If you go from lifting nothing to lifting something really heavy, then yes, you may have a problem. But if you do it in a graduated sense, it should be okay. A weak core does not necessarily cause low back pain, and actually some patients can over-tense their core. But on the flip side is that having a strong core is good for your overall health, as it's as a strong core will allow the muscles to activate when they are needed. So it is good to focus on core strengthening, but it's not like having a weak core has caused you to be in the situation you're in. Spine movement and loading is safe and build structural resilience. Again, the key point here being a graded increase in what you are lifting. Pain flare-ups are often related to changes in activity, again referring to that example of going from not lifting anything to lifting something really heavy. Or for example, if you had a weekend where you were helping someone move house and you were doing a lot more movement and lifting than you're absolutely used to, yes, you may end up having a little bit of worsening, but it will settle. Changes in stress and mood can also be triggers for low back pain, more so than structural damage. And really effective low back pain care is relatively cheap and safe once you kind of get into your routine of it. So these are just a few of the references I used for this presentation. I know it's a little bit long. I think it's useful. And please let me know if you think it's useful or if there's other things that you wish for me to cover. So thank you for your time.